Good afternoon, Aspen.
Good afternoon.
It's great to be here. So today we're talking about mental health is the new normal. And I want to start off by just sharing that in New York City, we conducted a needs assessment to really understand what are the barriers that get in the way of children and families thriving. And the number one barrier was mental health. And it was number one because as the residents and people who work and live in Lower Manhattan told us, it can happen at any stage. It can happen to you regardless of race, regardless of socioeconomic background. So we are talking about mental health in this country in ways that we haven't ever before. And that's a good thing because we're increasing awareness. We have a new young generation that has language that most of us didn't have growing up to talk about mental health. And so we're helping to kind of remove the stigma around mental health, but access continues to be a critical issue for us. And so we're going to talk a little bit about some of those issues today. But the other thing I want to lift up is that the people in New York City said, can we just call it emotional well-being? Emotional well-being as a way of reframing mental health, as a way of moving away from stigma, as a way of acknowledging that we should all be emotionally well. So we're going to use some of that language today as well, and I encourage and invite all of you to use it as well if you're not already using it. So before we kind of take a deep dive in, Ron Lee, can you just get us started and do some level setting? Tell us a little bit about what the state of mental health is in the United States for our children and families.
Thank you so much, Lorelei. And I'm Ron Lee Liaw. I've actually relocated from New York City to Colorado in the last 2 years, and I wish, thank you Coloradans here. I wish actually, my first time to Aspen was 5 years ago on the Aspen Ideas stage, and I wish I was going to tell you something different than I said back then. Right now, in the state of Colorado, where we're sitting now, the number one leading cause of death beginning at age 10 is suicide. I work at the Children's Hospital in Denver. We have hospitals across the state. We regularly have 6, 7, 8, 9-year-olds in our ICUs and our emergency departments who have tried to kill themselves, have made suicide plans. It is an epidemic at a national and global perspective, really, proportions. Gun violence is the number one killer of kids over the last couple of years, whether it's homicides, accidents, suicides, community violence, domestic violence. It's guns, actually. I was recently on a transitions team for the city of Denver for public health. We're in the middle of a syndemic right now. So those in the room who are healthcare workers, and actually all of us who are living through the COVID pandemic, there's concurrent epidemics of infectious disease, of gun violence, of mental health crises, of addictions, of homelessness, right? In high school, 40% of high school students across the country pre-COVID told us that they felt persistently sad or hopeless for 2 weeks straight. They couldn't engage in school and friendships and activities, with a quarter of them considering suicide. For girls in high school, it was 60% sadness, hopelessness rates. For LGBTQ youth, it was 70%, with 1 in 5 having attempted suicide at some point in their adolescent years. It is of catastrophic proportions, and those of us, I think, working on the front lines in the mental health field or in the emotional well-being field, actually all of us in the room, there's a level of urgency that I've never seen before, a level of willingness to talk about these issues that I've never seen before, a lot led by our young people asking us to come together to find solutions that will work and help. So thanks for letting me set the stage.
Yeah, thank you, Ron Lee. So in contrast to that really kind of dark reality that we're all living through right now, I'd love to hear what your dream is. What is your dream for a country that has a robust state of emotional well-being? What does that look like? What does that feel like? What does that sound like? And Laura, let's start with you.
Sure, thanks, Lorelei. You know, it's interesting to be a person who is working in the field of museums and libraries, and you think, well, after what Ron Lee said, why am I here? Why do we belong here? And you know, I think we belong here because we know that connection is one of the most important and powerful antidotes to poor mental health and to feelings of isolation. These are places of gathering and togetherness. There are places where you can be alone together even, and that might be the best thing about them. And so from where we sit, we also think about, from a dream perspective, what if those safe and nurturing and enriching spaces were available to everyone, to every child, to every family? And that's something we've been talking about in our community for a long time, but we saw the proof and the confirmation of our own belief of the power of these gathering spaces during the pandemic. Because when we were in lockdown, people found those places to go to. Public gardens had their best attendance in the last 20 years during the last 2 years. Zoos and aquaria were visited by 2 million more visits over lockdown than they had been in the previous 5 years, because we need places to go. But we need them all the time. We don't just need them in crisis. So I think that's part of my dream, is that we have access to beautiful places. This is one of them, and we're blessed to be here. But not everybody can be here. And around the world, we should be looking for that too, as part of our strategy for not being reactive, but being proactive and lessening the work, Ron Lee, that you and your colleagues have to do.
Thank you, Laura. Laurie, what's your dream?
My dream is that I wouldn't have notes and wouldn't need reading glasses, but here I am. My connection to mental health is deeply personal and professional. I'm a clinical child psychologist, and like most mental health professionals, I chose this career in part because of my own childhood experiences. And like most of us, my family, my very close friends, my colleagues, and truthfully almost everybody that I know has struggled with mental health challenges. But unlike most of them and most families out there, I experienced these challenges as a child, as a daughter, as a mother, through a lot of privilege, giving me access and opportunities that most people don't have. And so my dream is for our nation to promote mental health at a population level for all children and families, but especially those who are most marginalized. My dream for our nation is that our public systems are free of structural racism and white supremacy. Small dream to have. That schools can be safe and nurturing and predictable places, both for children and for parents. I envision a nation where principals, school-based mental health professionals, too few of them out there, and educators engage in professional development in experiential learning communities that emphasize the importance of family engagement and social-emotional learning. Educators would be supported to examine their own beliefs about children and families, especially those who have different lived racialized experiences than their own. Schools would treat parents as true partners and offer evidence-based, culturally responsive programs for parents facilitated by mental health professionals, where parents could learn from each other and discuss the joys and the challenges of parenting young children. And where all classrooms and home environments would be safe, nurturing, and predictable places for all children.
Thanks, Laurie. Ron Lee, what's your dream?
Well, now I have glasses too, Laurie, but no notes, so I will share. I recently had an opportunity, I'm on a national task force to provide strategies for the Center for Medicare and Medicaid services for the highest complexity, highest acuity youth in the country. So that we were all comers from all different states, all different backgrounds. I was one of the few healthcare providers on the task force, and we had the privilege of spending time with some of the young people from Youth Move, which is a national organization that has chapter-based organizations in every state where young people are using their voices to really change the systems that touch their lives. And the irony is actually everything that Laura and Laurie just touched on, young people said first. And we asked them the same question, what would be your dream for mental health? And they also don't like the word mental health, right? And so for your emotional well-being and thriving. Of course, it was interesting to me as a child psychiatrist, right, gone through healthcare training all the way through, that nothing they mentioned had anything to do with our traditional mental health system, right? They said, the things that help me most are my trauma coach, the healing circle in my community, right? Some of the arts programs that I've been able to be a part of, right? Also the people who care about me in my school, who know me, who know that I want to go to college and that I need help navigating that system. Some of them said, I need you guys to dismantle the structures that are perpetuating inequality and lack of equal opportunity. I need you to pay my parents and my foster parents a living wage so that I have a safe place to live and I don't have to switch homes every 3 months, right? I need you to make sure that everybody has health care coverage that also includes both mental health supports and physical health care and coverage, and that those would also cover informal sources of support that have been really valuable to me, that we'd have healthy food and access to that, that I'd feel safe in my community, that I feel like I belong and have connections, and I can find my purpose in my life, because I can't thrive if I can't survive. That's what each one of them said. Help me move from surviving to thriving, because then I can use your mental health services in your formal mental health system. Right? So where is that place where mental health is health? We say that all the time, that catchphrase. If we have a kid who comes in with cancer, they don't sit in the emergency room for days, for weeks, for months, for years with nowhere or no service in sight. They get admitted right away into our cancer centers. They get treatment the next day. They're on clinical trials, right? We're fighting to save their lives, and we don't have that same level of urgency at every level of government, right? From the federal government down to your local city council. Everybody would need to have that level of urgency, and kids said, hey, let us be part of that conversation. Ask me what I need. Ask my family what we need and help us get it, right? Because without our voices in the mix, it's just people in a room trying to fix things 10 years from now when this is my life now. So it's really amazing, actually. It's a similar conversation. They would want museum and zoo and garden passes for sure, right? And local access to all of those things.
Thank you, Ron Lee. And I love that the thread in the three of these responses is about centering community voice. And that is one of the key principles of the work that we do with Ascend. So thank you all for that. Laurie, I want to pivot a little bit and talk about your program, Parent Core. So you have really successfully scaled up Parent Core in New York City in partnership with the Department of Education. You have now taken it on the road across the country. You're implementing Parent Core in different cities across the country. Tell us, first of all, help the audience understand what Parent Core is, and then also tell us, what are you learning from the research you're doing as a result of all that really good work?
I will. Parent Core is an enhancement to public pre-K programs that includes professional development for educators and leaders, for principals and directors of early childhood education centers, a program for parents of all pre-K students, and a social-emotional learning curriculum in the classroom. Over the past 7 years, we've had the opportunity to scale Parent Core in New York City. And in fact, when I started my Ascend Fellowship as part of the second to none cohort, this was my big idea, to scale Parent Core, an evidence-based program that I had developed 20 years earlier across New York City. So we did it. And through a citywide mayoral mental health initiative, Mike, we engaged thousands of teachers and principals in highly experiential professional development and supported more than 50 schools and centers to offer Parent Core programs for families and children to all those in their pre-K programs. And through the generous support of several family foundations, huge shout out to the Bezos Family Foundation, we were able to rigorously evaluate impact from these services on schools and families. So we now have very strong evidence, hot off the press. It's actually not even in the press yet. So I'm sharing here really for the first time, that schools that participated in Parent Corps professional development are experienced by parents, by over 9,000 parents, contributed to our data about how are you feeling about your school community, how are you feeling about the teachers, how are you treated, and they shared that these are primarily Black and brown parents throughout New York City, that the schools with Parent Corps, and they didn't know that the schools had Parent Corps professional development, et cetera, that they saw these schools as more inclusive, respectful, and I think most importantly, trustworthy. That these schools and the teachers and the leaders changed their behaviors in ways that we're still trying to understand, but they did things that made the families feel like they could trust them. This is, I think, transformative. And we also know from years of research that children who attend pre-K programs in schools with Parent Corps have significantly better mental health outcomes over time, with 50% fewer mental health problems by second grade in terms of anxiety, depression, as well as behavior problems. So under the leadership of our new director of our National Office for Parent Corps, yay, Kayema Hamer, we are now working to scale Parent Corps throughout school districts and Head Start programs across the country. So I want to give a huge shout out to Ascend for giving life to my big idea. It's really come true, and it really is a dream come true for me, for providing seed funding for our first pilot outside of New York City, which was with another Ascend fellow from second to none cohort. And we have scaled in Detroit across all the Head Starts with Starfish Family Services. Really proud of that beautiful work. And really for teaching me so many life lessons on value-based leadership and what it takes to share power and listen to and lift up women of color.
Thank you so much, Laurie. And that is incredible. I think you deserve a round of applause for the work that you've done in leading that really important work. And I want to lift up the finding around relationships, right? When all it takes is one relationship. We know that relationships are the #1 mitigator of toxic stress and adversity. So all it takes is for a child to be connected to one caring adult. And what you're doing is building community in these centers, and that's so critically important. Laura, so we talk a lot about third spaces, and you are working closely with museums and libraries. Tell us what the role of museums and libraries, what is the role around emotional well-being?
So, they really are, or aspire to be, these places of both connection and service. How people can connect to humanity. People think that museums are about the things in museums. There are museums without things, but that's what we think about. But really those things are just a way to teach us about ourselves, and they really are sort of temples to humanity and what we're able to understand and discover and create. And so as these third spaces, right? Home is your first space. Institutions like schools, like hospitals, like these formal systems, those are second spaces. And so third spaces are these shared community spaces. And they are these places of social interaction and civic engagement and finding our power as individuals that are part of a complex ecosystem. And so again, thinking about how they can be mitigators and positive environments for good person-to-person relationships is what we're hoping to be. And one initiative that we're a part of that helps museums leverage that is our Museums for All program, which is really a campaign that invites museums, it's all voluntary, invites museums to offer free and reduced admission to people who receive SNAP benefits, so people who are experiencing food insecurity, which we know is part of that safety, toxic stress system. And so this allows museums to extend an invitation to people with disabilities, families, seniors, people who we know are at risk every day for not living a healthy life. And there was a real question about whether this would be a valid and valued and valuable approach. And well, here's what it turns out is that museums have signed on. We have over 1,200 museums in, and it's a year-round process. It also asks them to show up authentically, so they don't get to determine when those people are invited. They are invited always. The moment the doors open on every single day they are open, Museums for All folks are invited, and just like military folks, like teacher discounts, they are a valuable visitor. And so we've had 1,200 museums come on, and we've had more than 7 million visits to museums by people who receive SNAP benefits. And we're starting to see the change in relationship at the ground level, that there are testimonials left by parents who say, thank you for letting me give this. I always get emotional, sorry, I'll breathe through it. To my child who I know is suffering because I cannot provide the stability that they want, but this is a place that makes me feel like a good parent because I can bring them here to the Field Museum, or I can bring them to, the Children's Museum of Houston or the Met. We have incredible institutions that are powerful places. So all that to say is, this is one example, but it's just proof that people want to be part of the world no matter what their resource availability is, and there are ways for us to reach them and extend invitation, to extend well-being to them, to raise their self-esteem, and to empower them to be proud of themselves and be powerful parents, aunts, friends, and allies if we think about leveraging our spaces.
Thank you so much, Laura. That is so powerful. And as I'm listening to you speaking, I'm thinking about, I had a conversation recently with folks at the New Jersey Partnership for the Arts, and they got a grant recently to begin to show evidence that access to the arts actually helps with mental health. And so they are working on that and working closely with the Office of Medicaid to illustrate that. And that's, ultimately getting that policy change is where it's at. So thank you for the work that you're doing. So to close us out really quickly, 1 minute for each of you or thereabouts. Tell me, and Ron Lee, we'll start with you here. Share something with all of us about something new that you've learned around joy and thriving for children and families. Just a nugget, share something with us.
All right, in a nugget then. So my area of study is trauma and resiliency in children and families. And there's a quote that I love in the resilience literature that relationships lie at the roots of resilience. And now I feel it's the same, actually, that relationships lie as the soil, the roots, the sun, the water for joy and thriving for kids and families for many generations to come. So that's my nugget. And her son cooked for Beyonce last night, so I just want to say that's joyful to me. I'm just going to put that in there. Sorry.
Thanks, Ron Lee. Laurie.
All right, this one I'll do without notes. I would say it's sort of amazing and joyful to me to know that systemic change is possible. It is possible to disrupt racism, systemic racism, and address white supremacy in the largest school system in the country. And we did that, and I think that, as Ann Mosley, I believe, Ann, I'm going to attribute this to you, said during our fellowship, something that I learned was an aha moment, like these systems are just people. And people can change. Change develops with relationships and trust. And if we can just do that and disrupt white supremacy at every turn, we can move mountains so that parents can just appreciate the joy and love that they have for their children and help their own children to thrive.
Thank you so much, Laurie. Laura?
I think for me, that nugget is the pivot that you opened up for us, Lorelei, at the beginning around well-being, because I think that it invites more of us to be a part of it. When we talk about mental health, that feels like somebody else's job. And when we talk about well-being, it's part of all of our jobs. And it allows, we've said joy so much. In our prep, we didn't talk about joy this much, but we're talking a lot about joy. And I think that's just an important thing that I'm carrying with me from our conversations today.
I want to thank the three of you, Ron Lee, Laurie, Laura. You guys are rock stars. You're doing the work. Thank you so much. Please join me in thanking them.